My name is Sam Cares. I'm an intern here at Rogers Behavioral Health. I'm in the OCD and anxiety track here at Cedar Ridge. When I was looking for an internship, I knew I wanted to work with the OCD population. I've had a lot of experience at the outpatient and PHP levels, and the residential experience offered by Rogers was sort of the next natural step for me in my career and my experience. And I knew it would be more challenging and would really help me grow as a professional.
My name is Johanna Younts, and I am a doctoral intern here at Rogers Behavioral Health at the OCD anxiety track at Cedar Ridge. I applied to the internship because of several reasons. One, I'm highly interested in OCD and anxiety and want to continue to work with that population in my career. It's also a really great hospital system. It has locations throughout the country, and you get lots of opportunities to work with really severe and complex patient population and learn a lot in the process.
So on a daily basis, we're really working at a couple of different levels with the residents here. We work with them individually to work on their exposure hierarchies, troubleshoot any exposures. We work with them in groups. There are different types of groups that are offered here, DBT groups, CBT groups. As interns, you get the opportunity to lead the CBT group, and it's a really cool experience, and residents are very frequently involved and active in those groups. We also engage in a lot of team meetings, sort of the behind the scenes stuff. The multidisciplinary teams here are really helpful. There's usually a psychiatrist, psychologist, behavior specialist, therapist, and then us interns. It's really collaborative, it's really helpful, and I think really helps support the residents get to where they want to be by the end of their treatment.
The interns share an office together, which is a great opportunity to build that relationship and have someone to consult with during internship and beyond.
The OCD and anxiety internship track is located at Cedar Ridge, which is kind of its own thing away from the main campus. It's located between two lakes and surrounded by a forest, essentially, with all sorts of animals and nature that come right up to the building. Patients are able to walk the trails here that we have behind Cedar Ridge, and they kind of go through the forest and along the lakes. And that experience, I think, really helps to support their treatment and support the tough work that they're doing here throughout their stay.
Hey, how's it going? Good. You want to see me?
We're supervised, but we're also supervisors. We have plenty of opportunities for supervision of our own throughout the week to ask questions, get consultation, get feedback, and sort of have any questions that we have answered. And then we also have the opportunity to provide supervision to practicum students from a local university who are working on their training as well. For me, that was one of the big things that drew me to Rogers, was the opportunity to provide that supervision. It's an experience I hadn't really had much before this, and I'm already getting a lot out of it.
The internship at Rogers is preparing us to have a career in psychology in multiple ways. We get to see some of the most severe cases in the country, which can definitely prepare us to see any kind of cases moving forward in our careers. We get to practice supervising practicum students, which is something that many psychologists choose to do in their careers and is not something that every internship offers. We also get to work on an interdisciplinary team, and we get to learn about what our role as psychologists are on that team.
What surprised me about internship, and I think it is turning out to be a really good thing for my training, is how complex the cases are here at a residential level. The complexity of the OCD, the comorbidity with other disorders, is really providing a good experience for me in my training and is really going to help me moving forward. It's really what I was looking to get out of internship.